With the recent outbreak of the coronavirus within various portions of the United States and the world, the government has been taking numerous measures to help slow the spread of COVID-19, along with doing its best to prevent more deaths. However, there are still many questions about COVID-19, and one of the largest that many people are asking is exactly how does it differ just from the seasonal flu? So, besides just the death rate of COVID-19 being estimated to be about 10 times that of the seasonal flu, the rate of the spread of COVID-19 is also much larger than that of the flu. So while the seasonal flu infects about one additional person for every one person already infected, it is estimated that each person infected with COVID-19 can infect on average about 2 to 3 others. For this reason, the growth rate, until extra measures and restrictions have been put in place by the government, the number of active cases of COVID-19, the rate at which that grows is going to be exponential. To get a better idea of how such exponential growth operates, we can look at the commonly used example of lily pads in a lily pond. So let's assume there is just one lily pad to start. However, every minute the number of lily pads doubles. So at the end of the first minute there are 2 lily pads, at the end of the second minute there are 4 lily pads, and so on. Now let's say at the end of 60 minutes the whole pond is covered. The question is then, at what point was the pond only half covered? And the answer would be at the 59th minute. Just 1 minute before the whole pond is covered, exactly half the pond is covered. And this is sort of the whole concept of exponential growth, and especially in this scenario, because at every minute the number of lily pads is doubling, it's just going to take 1 minute for the whole lily pond to go from half covered to full covered. Now, an even more interesting question to be looking at is exactly halfway through the whole timeline. So at 30 minutes, how much of the pond is covered? And the answer is that only about 0.0031% of the pond would be covered halfway through the whole timeline. And that can really show just how small of a portion size can be covered halfway through the incubation, in this case, the doubling of the lily pads. But within a half of it, only about 0.0031% is covered. But then within the next 30 minutes, the whole pond is covered. And that really shows the rapidity of exponential growth. Now, obviously, the spread of the coronavirus is not identical to lily pads doubling in a pond, but the point is that since the rate of spread of the coronavirus is exponential, once the number of cases begins to increase, the rate of spread will increase at a faster and faster rate, which can have serious detrimental effects. From the lily pad example, halfway through the timeline of the coronavirus spread, a small portion of the populace may be infected, but if drastic measures are not taken, that number can become much larger in just the exact same amount of time. So a common graph that has been generated to show what the COVID-19 active cases would look like without any extra measures to help taken to help the situation is now shown on the screen in red. So the first graph is the expected trajectory if we do not take any action, which would mean devastating record of high number of people who have contracted the virus and deaths in just a short time period because it is beyond what our medical system can take, and many lives would be lost due to the lack of medical attention. An overburdened and stressed healthcare system and caregivers will spill into every sector of our interconnected society. And this is also the biggest difference between the flu and the current coronavirus pandemic is the unexpected surge of large numbers of sick people beyond the capacity of our existing medical delivery system. So along with this, we can see the flatter graph with its peak to the right of the peak of the red graph. So the flatter graph is displayed in blue. And now the main difference between these two graphs is the potential COVID-19 cases is the peak. So if the spread occurs too quickly, which it does in the case of exponential growth in the red graph, there will be many active cases which go beyond the number of cases for which care can be given with our medical system. So you can see the dotted line is the potential that our medical system has to offer care. And now in the red graph, at exponential growth without any measures in place, we can see that there are a lot of active cases that go beyond the total capacity. And then we run into various issues of people not being able to get the adequate care that they require from this, meaning that there are more deaths than what there should have been. However, if we flatten the curve, which we can see in the blue, even the peak number of active cases will be lower than the capacity, and the crisis will be manageable, meaning everyone can get the potential care they need. And this is exactly why flattening the curve of COVID-19 is important, because it allows everyone who were to get the virus to receive the care if they needed it. Without it, there would be a shortage of medical attention and care, and that could have disastrous effects on the population as a whole because there'd be so many people who would need such care but cannot get it because there are other people already receiving it, and that our medical system cannot operate to that capacity. So now, given all this information, some of the questions, that rise at this point are, now where exactly on this bell curve graph are we, and how long will it take for the whole situation to pass over, meaning that we peak and are on the down end of the curve. So the light in the situation is that it is still in our hands, and partly the government's as well, to change the course of this pandemic. So now Dr. Zinser informs us a little bit about where exactly the United States is on the bell curve that we see, along with how the United States is progressing in terms of the coronavirus spread.
We are just beginning the rapid rise. So a week ago, there were just over 200 cases reported in the United States. And here, 7 days later, there are around 2,000 cases reported in the United States. The way this is mathematically modeled is 2 to 3 people are infected by every person who has the virus. And so, the average time to developing symptoms is 6 days. So if there are 2,000 people that we know about now, that means that there are probably 4,000 who are not yet symptomatic, but will be symptomatic within 6 days. That would give a total of 6,000 in 1 week. If you carry that out, in 18 days, there would be 30,000 cases in the United States. And if it weren't controlled by then, it would be a true disaster.
Dr. Zinser also talked about how we can go about helping to flatten the curve, along with the benefits that flattening the curve would provide.
So if we flatten the curve out, we would be able to have a much better chance of treating the severely ill patients, the critically ill patients.
Right.
If we don't flatten that curve out, there will be thousands of deaths that could have been prevented by flattening the curve out. So flattening the curve out means that if we want it to be flat 2 weeks from now, we have to act immediately.
So now, at this point, everyone is sort of looking forward into the future and looking forward for this whole pandemic situation, to pass by. There have been detrimental effects of the coronavirus beyond just deaths. I mean, the economy of the United States has been on a collapse, and there are various businesses that have seen massive drops in sales. So the bigger question at this point is exactly how long this is going to take.
It's hard to make that estimate because it depends entirely on what actions are taken now.
And Dr. Zinser is completely right in that it at the current rate, it really is impossible or nearly impossible to tell exactly, how long it is going to take for this whole thing to pass, because there are so many factors in effect. Now, while it can be very difficult to actually predict how long the entire coronavirus situation will last in the United States, we can look to other countries who also are facing an epidemic of the coronavirus within their country to see how long it took them. If we look at China, where the coronavirus originally began, we can see that from the first recorded case of coronavirus in China, it took about 3 months for the virus to actually peak in the number of active cases. And now, after 4 months, China is getting close to completely reducing the coronavirus number of active cases. However, it is still important to remember that even once China has gone through the whole sort of bell curve and is now on the very low end of the bell curve, there are still 10,000 active cases of the coronavirus within China. And this is after they put a lockdown on numerous cities and put heavy restrictions on the entire province of Wuhan, where the virus began. Similarly, in South Korea, it took about 2 months for the virus to peak, which is where it's at right now. And in South Korea, the virus has just begun to decline from the peak in terms of the number of active cases. And that's about 2 months since the first recorded date of the coronavirus within South Korea. And this is actually quite impressive considering that South Korea is very close in closity to China. And has handled, and they have actually handled this coronavirus situation much better than many other countries due to their increased number of testing. And so if we sort of look at this in terms of where the United States is still unfortunately in the upward swing of the number of active cases. So 3 days ago, from when this is being filmed, there was an increase in 400 active cases. 2 days ago, there was an increase in 500 active cases, and just yesterday, there was an increase in 700 active cases. So we can see that the specific increase in the number of active cases each day is still increasing in the United States, which means that we are not really too close to the peak itself yet. So looking forward for the United States, there's sort of two stages that the coronavirus situation can go through. And the first stage is to actually reduce the number of active cases that are happening per day. So instead of having an increase in 700 active cases per day, we want to bring it down to 600, then 500, and so on. And once the increase in active cases becomes zero, the United States has reached its peak in terms of the number of active coronavirus cases. And so that's stage one. Then stage two would be to actually decline from there and make sure that the measures that are in place and what people are doing is actually effective in not making sure that there are, less active cases and reducing the number of active cases from there out. So from here on out, the amount of time it takes can be difficult to determine because it relies a large part on how people are taking care of themselves, how people are, doing social distancing and quarantining themselves, or, listening to what the government's saying, getting themselves tested, and, making sure that they are adequately responding to the recommendations of the CDC, the WHO, the Department of Health, and all these things. So the more that people respond to it, the faster the United States can go through these two stages. The graphs speak for themselves. We can see that it is always going to be beneficial to flatten the graph because it allows people to get the adequate care they need. However, we can also collectively shorten the duration of this outbreak by social distancing and by strictly adhering to the recommendations of experts, the CDC, the Department of Health, and the World Health Organization.